The reality of the existence of the coronavirus is one that many Nigerians must take seriously, especially with the rising number of deaths, sadly among them the death of a prominent Delta State lawmaker. With the spike of confirmed cases in the second wave, the government and school authorities in Delta State say they are doing all that is necessary to control the spread of the virus.
In the early hours of today, residents of Delta State woke up to the news that the majority leader of the Delta State House of Assembly, Honorable Tim Owefere, had passed on. Owefere, a fourth-time member of the Delta Assembly, reportedly died of coronavirus-related complications at the Federal Medical Center, Asaba, where he had been undergoing treatment for a while. Before now, the Delta State government had ordered the reopening of schools in the state with conditions that all schools must adhere to safety protocols. Most schools, such as this one, have taken it as a matter of responsibility to ensure that all pupils and teachers are checked, masked up and hand sanitized before they are allowed into the premises.
If there's a way they can do the testing so that teachers can also get tested, since they are the ones that are with our children every day, so that because we don't know where they are going to, who they are meeting, so there's a way they can maybe make it compulsory for teachers to get tested. It will really make parents be at peace.
Inside the classrooms, teachers are also cautious of the virus as teaching and learning go on.
Coronavirus is an airborne disease, that's why we are wearing face masks, so we don't breathe in the disease.
The school is also on the lookout for cases of children coming in with fever and other COVID-related symptoms.
I'll just say that everybody should know that it's real. It's not something, some people still don't want to believe it, but we should all know that it's real and we should take care of ourselves. If you think you are asymptomatic, for example, you don't know what other side effects you might have on you in years to come. So avoid anything that you need to, whatever it is that the guidelines that is being laid out, avoid them as much as possible and keep yourself safe.
Meanwhile, in the marketplace, caution is being thrown to the wind as a lot of people here appear nonchalant about the happenings around them. Buying and selling without the use of face masks and social distancing completely ignored. According to the NCDC, Delta State has a total number of 2,249 confirmed cases. Of this number, 460 cases are active, 1,737 already discharged, with over 50 deaths recorded. The latest being the majority leader of Delta State House of Assembly.
Let's talk some more about what's happening in Delta State. And joining me is Dr. Victor Osayatuma. He's the CMD, Federal Medical Center, Asaba. Thank you for joining us on the program.
Well, a pleasure to be here.
The last time I spoke to you, that was during the first wave, and now here we are again. What's your take on this new wave, especially how it's hitting Delta State?
Well, the new wave, like we're experiencing in other parts of the country, is on a steady increase, on a steady rise. And the hospitals are almost being stretched to capacity. As I speak to you, all the beds in our isolation treatment center are fully occupied. And some patients are now being managed in the private facility, even unknowingly, and that makes it worse. So at the time they refer to us, the patients are even coming in very bad. And, some of them with pneumonias that have been tagged community-acquired pneumonias, which by the time we screen them, we find out that they have been dealing with COVID. And so IPC, follow-up and all of that has been a little challenge for the number of staff on ground. But by and large, we're trying to see how we can cope with all of this, with the support we're getting from the federal government and the state government as well.
I mean, the health crisis is being felt across the world. Looking at perhaps those who are most vulnerable, I know you've mentioned some pre-existing illnesses. When we hear someone has died from COVID-19 complications, what exactly does that mean? And what are some of the ways that Nigerians can protect the most vulnerable in these times?
Well, what it means is those that are most vulnerable are most likely to succumb are those that have comorbidities like diabetes, like hypertension, like renal diseases or liver diseases. It becomes difficult for the body to fight the infection, and so it becomes easy to fall prey. But for those who do not have that, they have more immunity and have more ability to fight and have better chances of surviving. In the United States, quite a number of people have some of these comorbidities. At least most of the ones that we have lost had comorbidities. Only very few, less than 5%, didn't have comorbidities. So we say they are COVID-related deaths because actually they died from severity of those comorbidities, but the ability of the body to recover from them becomes difficult because the COVID weakens the body's immune response system. So that's what we've been experiencing.
You talked about the ICU units being almost full to capacity, beds running out. I mean, looking at the markets in Asaba, it appears there is a flagrant disregard of some of the protocols or the measures that you would expect Nigerians, Deltans, to take into consideration. Does this give you concern?
It does give us concern, and the state government is looking into it seriously because we have also made our concerns known that the public places, the market in particular, they are not observing any of the measures. You see the face mask is been turned into a chain mask. Even if they put it on at all, it's in a chain. Nobody bothers to cover the face, the nose and the mouth. And it's difficult getting people to comply now. Some of them still are living in the past, believing that the COVID is not real and that is only a propaganda. And that is the most difficult thing to deal with right now. People are making the job a lot more difficult with their attitude and their behavior. You go to shopping malls, you hope it's filled to brim. People are not observing these protocols, and I think we need to press a little harder now, because if we can put these measures in place, it will help to a large extent to reduce the number of infections we're getting per day. So we need to do more to enforce all of this.
Some of the solutions we've been told, other than the non-pharmaceutical protocols, are tests and, of course, the right treatments and then the vaccines. Some people have complained that they've not had access to tests for COVID-19 and it appears to be slow. How do you think that can be solved?
Well, NCDC and the federal government has made more testing centers available. Before now, we had just one at the Asaba Specialist Hospital, but now we have 4 across the state. We at the Federal Medical Center, we're testing now. The Warri Central Hospital, they are testing, and at the Delta State University, Abraka, Ogara, they are also testing. So 4 testing centers. So we have increased testing capability now. Just that we cannot test everybody. We still don't have the capacity to test everybody. So we are still selecting our cases. The patients are priority. Those that have symptoms are priority. Those that are exposed are priority. And then, IPC follow-up. So we cannot test everybody that comes to the hospital. We cannot test everybody that comes to the public place for now, even though we have increased our testing capacity.
All right, we appreciate your time. Thank you for the update. We've been speaking to Dr. Victor Osaituma, CMD, Federal Medical Center, Asaba. Thank you for joining us on the program.
Thank you. Have a good week.